Good morning, good afternoon, or good evening, wherever you may be, and welcome to the International Forensic Psychiatry Lecture Series, hosted by the Forensic Psychiatry Program at St. Joseph's Healthcare Hamilton, McMaster University, and the World Psychiatric Association. I'm Heather Molden, and I'll be your host today. Just a reminder that the lecture series is an accredited learning activity as defined by the Maintenance of Certification Program of the Royal College of Physicians and Surgeons of Canada and approved by the Canadian Psychiatric Association. We officially have surpassed over 1,000 registrants for the series. Thank you all so much for your support. It's my pleasure today to introduce Dr. Christian Joyal. He will be discussing using sexual fantasies to evaluate the risks of acting out, pitfalls, and potential. Dr. Joyal is a full professor at the University of Quebec at Trois-Rivières in the psychology department and a regular researcher at the National Institute of Forensic Psychiatry, Philippe Pinel in Montreal, and the International Center of Comparative Criminology. He's a neuropsychologist working in the field of sexology and a member of the editorial boards for the Journal of Sex Research, Archives of Sexual Behavior, and the Canadian Journal of Human Sexuality. He teaches classes in clinical neuropsychology, criminal sexology, and sexual victimology. Please join me in welcoming Dr. Joyal.
Thank you very much, Dr. Molden. Can you hear me?
Yep.
Yeah, it's okay, good. And I will share my screen. Is it okay?
No, we're seeing your presenter view, Dr. Joyal.
Okay. Okay, we will. Okay, I will switch the screen.
Take your time. There's always a.
Yeah, I know, but
yes.
No, do you see it?
Yes.
Or sorry, it's the correct screen that you have?
I believe so. Yes, it looks like
cool.
Your introductory screen. We'll let you know if there's any issues.
Okay, thank you very much. So thanks a lot, Dr. Molden, for having me here at your lecture series on in forensic psychiatry. It's really a pleasure for me to be here. Today, as you said, we will talk about the use of sexual fantasies in forensic settings, but also in general among the community as a predictor for acting out or the value of it. It could be a good value or really bad value. Will see today. If you have any questions uh, beyond the one that you will have today, you can feel free to email me at the address that is appearing now at the screen. I only have one email address. It's really easy to find. And UQTR stand for University of Quebec at Trois-Rivières, where I work. And I also as you said, Dr. Molden, I work at the National Institute of Forensic Psychiatry in Montreal. This is by far the biggest place where we are receiving so-called difficult patients in psychiatry, or people who have committed a crime for evaluation and treatment. And I also work in collaboration with halfway houses in Trois-Rivières, Montreal, and Quebec City. So one of the biggest, the main work that we have to do in these institutions is to evaluate the risk of reoffending. And currently, well, at least in Quebec and elsewhere in Europe, they are putting a great emphasis on sexual fantasies. So the question is a sexual fantasy a good marker or predictor for acting out or not? The answer, of course, is, well, it depends. And this is what we will see today. It depends on what. I would like also for you in the attendance to be aware that at least in Western countries now, we are developing more and more and more what is called primary prevention programs against child sexual abuse. It will be against, it will be more varied than that, but we begin with child sexual abuse. Here in Canada, CAMH in Toronto began the Talking for Change program. And in Quebec in French, we began 2 years ago the Ça suffit, which means it's enough program. Both programs are aiming at the general population. So we are asking people in the community, if you have any thoughts, sexual thoughts about children, please let us know, especially if you are unknown from the authorities or you have never done anything before. We will be here for help. And this is where we realize that if a given person is telling us about any fantasies that he or she has, we don't know much about the value or the non-value of those fantasies for the prediction of acting out the corresponding behavior, which is really delicate for a lot of reasons. For instance, if you have a duty to warn, if we have to call organisms or the police based on a fantasy, it's really complex but really interesting, I think. Now, I would just begin with the definition of sexual fantasy, because most people think that it is necessarily a scenario or a script, which is not the case. We are considering a fantasy. We are including thoughts and images, so it could be fleeting or it could be elaborate. It could be spontaneous or deliberate. So those characteristics, as we will see later, could be important in the prediction of acting out. It could also be associated with, of course, positive emotions, as we most of the case are, but it could be associated with negative emotions, and this would be important later. And it could be, of course, previously experienced or simply an imagination. And it could include themes that are realistic or not. And which are typical or rare or legal or illegal. So the main thing is that it is a mental imagery. So it is sexual fantasy is considered as a cognitive function based on the capacity to imagine, of course. Usually it's visual and it's sexually arousing. So it could be not arousing, but for the definition today, it would be sexually arousing. If it's not arousing, it's only a fantasy. It's not a sexual fantasy. Now, there are two ways to see the link between fantasies and risk of acting out. On one hand, we will see the classic, what we see in almost every handbook or clinical investigation. Those are the classic, for instance, from Gene Abel in 1974. The role of fantasy was and is still really important in what was called sexual deviation. And after that, a paper that is cited, I don't know how many times, based on 13 person, about the link between sadistic fantasy and sadistic offending. And now a lot of theories are based on papers like these. I would like you to be aware that there were no comparison groups in these studies, but still they helped to pinpoint some important aspect of the link between fantasy and behavior, which were pretty obvious. Like if you have sadistic behaviors, chances are that you also have sadistic fantasies. It's the same for repetitive child sexual abuse. The chances are that the person will have sexual fantasies about children. But for us, it was like, okay, this is pretty obvious. But there's no comparison group. So what about the community? And more recently, Ross Bartels and Gannon in the UK, which are really well known in the field of sexual fantasies, they still, and they are right, but they are still putting the emphasis of on the link between sexual fantasies and sexual offense. The problem with that is the fact that all participants are recruited in forensic or prison settings. They were all apprehended, and they are all non-sexual offenders. So we don't know about the rest of the population. Now, in this slide, you have over the years what we see in most textbook today is the fact that, just like in Hollywood movies, for instance, that people who have committed a sexual crime normally, not normally, but commonly, they have a very rich, active fantasy life. They have elaborated set of cognitions. You see here cognitions, extensive repertoire. This is in French, involving an elaborate sexual scenario or sophisticated and detailed sexual fantasies. And as we will see today, this is not the case for most of authors of sexual offense. It's not the case. But why are we still perpetuating this view is because those papers are based on really, really specific and rather rare, luckily, type of sexual offenders like sadistic homicide or serial sexual homicide, high-risk fantasies, harmful fantasies. And we all the time, we still are basing our practice on those, but maybe it's not that simple. And Ross, again, which I really like, by the way, nice guy, and Sunny Beach too, they are putting emphasis on the vividness of sexual fantasies as a risk marker for acting out. And vividness is the clarity of your imagination. And of course, it's indeed really important, the vividness. But as we will see, most of sexual offenders, they don't have a lot of imagination, and it's far from being vivid and clear. So again, this is the kind of puzzling, like, oh yeah, vividness, how come? Because in neuropsychology, we have known for several years that vividness of imagery is closely linked with what we call executive functions, based on frontal lobe cortex and including working memory. So something doesn't work here, because if you are interested in neuropsychology, this is my daytime job, to work in the neuropsychology of sex offending, and we have done that with adults and adolescents, and the main result is always the same, that there is a problem with executive functionings in people who had committed a sexual offense, or not sexual offense, by the way. So it doesn't make sense with the fact that vividness and fantasy should be so important for them if they are not kind of able to fantasize that much. And even today, another nice person here, Joel Burke in Germany. This paper is in press, actually. It's not even published, I think, but it's online. They wrote about from fantasy to reality, that self-reported aggression fantasies predict sadistic behavior among this time people from the community. So this type of conclusion, although it could be right, it could also be kind of dangerous, because if we are asking people from the community, in this case, or most of the cases, they are college students, mostly in psychology department. If you are asking them about sexual fantasies with aggressive content, you could be you could lean toward thinking that these person are at higher risk to commit a crime, which is not necessarily the case. So that's why I would be very careful with that kind of conclusion, especially when you know that they considered as sadistic behavior, such mainstream behavior like handcuffed, being tied up, being spanked. It's not necessarily sadistic. And their other variable was not non-consensual sadism, but it was presumably. So they asked people, if you were sure that you will never be caught, would you do this? So it's delicate matter, and that's why I wanted to present to you what we think about that. Because on the other hand, for those who known your, it's important to know your classics, to know like what has been done before you were born. Or a long time ago. And here are the so-called FBI researchers. They are not really researchers, but they are working for the FBI. And I think it was in 1987 or 95, something like that. They already stressed the fact that the ability to fantasize is highly dependent upon the intelligence of the person. So you need to have a complex scenario. You need to have a continuity of thought, which is like working memory based on executive functioning, which again is usually not that good among sexual offenders. So that was a long time ago. And it seems that we kind of never thought about it or think about it. And today, now, when my grandfather was not born, in 1933, they published a book about children's dreams, and they, at that time, stressed the fact that children with low IQ, they tend to fail to report any daydreams, and the response that they don't know, they don't remember. They kind of have a lack of inner space or inner fantasy part, and the capacity to imagine. And another classic in 61 by Jerome Singer at Yale University, they demonstrated that children who have the capacity to imagine, that's in this case, it was called the spaceship experience, to imagine themselves into a spacecraft. They had also the capacity to wait So they were not impulsive. On the contrary, so imagination was already linked with inhibition, behavioral capacity to inhibit oneself. Now, more to the point of sexual offending, this is another classic that we barely talked about for about the college male subgroup here. We talk about the scale, we talk about sexual offenders here, young teenager or young adult, and they were compared for sexual fantasies. And it's really striking the fact that college males, they not only had much more sexual fantasies than sexual offenders, they also had more the so-called deviance scale, which would be called today paraphilic scale. They also had significantly more sexual fantasies about paraphilia, paraphilic behavior, and mild coercion, excuse me. So they said in 1998 that contrary to clinical lore, criminal activity may be associated with suppressed level of fantasy. They said non-deviant, but deviant too. So it's suppressed level, but nobody talk about that. I don't know why. And another really interesting study in 1997 by O'Donoghue and Elizabeth Letourneau, they again they developed a scale, but everybody talk about the scale. They don't talk about the fact that students, college students, again had significantly more sexual fantasies than adult sexual offenders. And this included fantasies about bondage, and it was just a bit more about citizens. So this is what I think is it's really puzzling and interesting at the same time. So a few years ago, this is unpublished. We got preliminary data based on the thematic perception test. This is from psychodynamic. It's a psychodynamic classical test that serves for other purposes. What was interesting for me in this was the description of pictures that young adolescent sexual offenders had to told us. Now, of course, it's in French here, but you can see some examples like the guys were not able to describe this scene. Is this a woman? Is she tired? Is she depressed? Is this a gun? This is the couch. There's a lot of things to say. And here it's like, I don't know. I have no answer. I really don't know. Nothing comes to my mind. And it was all over the place. So we were wondering that this is the opposite of having a really rich fantasy world. It's quite the opposite. And more recently at Pinel Institute, again, you cannot read that. It doesn't really matter. It's all in French anyways. It's not the content that is important here. It's the fact that we ask, again, this is an ongoing study, more than 70 teenagers. They are all at our external youth clinic at Pinel Institute, and we asked them to describe their favorite sexual fantasies, and some of them, it was like, I don't know, or it was really, really vague, and they used like 3 to 10 words, that's it. And from that time, 2 years ago, clinicians at Pinel, they began to ask a youngster to describe an apple. Just describe me an apple, and they have a hard time to do that. So we went on to ask people from the community, the general population, about their sexual fantasies, because, as I said, most of the study, even today, they don't include a comparison group. So if someone with sadistic behaviors has sadistic fantasies, that doesn't say much, because we don't have nothing to compare them. So what about the general population? First of all, I guess being in forensic psychiatry, that you are all aware of the definition of paraphilia, which means sexual interest outside of the norms. And the DSM-5 even called it anomalous sexual interest. And in the DSM-5, also in the ICD-11, by the way, interests is defined as intense and persistent fantasies or behaviors. Before it was and behaviors. Now, if you only have the fantasy, it could meet the criteria of paraphilia. Maybe not paraphilic disorders, but at least paraphilia. So you could be considered as having anomalous sexual interest if you have, say, fantasies about rape, which is pretty common, by the way. So this is, I think, it's a problem, but to address it, we needed to ask people from the general population about their sexual fantasies, which we did. This is in 2015, and we realized that among the general population here, these are the rates for male. If you are interested, this paper is available freely. We took a look at some illegal themes like abusing a person who is drunk, being forced to have sex, watching someone, like voyeurism. This is so mainstream, like almost two-thirds of the sample reported that. In opposition to having sex with an animal and having sex with a child under the age of 12, this is considered as being rare. So with these data, we realized that if we follow the definition of the DSM-5, 57% of the general population met the criteria of paraphilia, which is, of course, way too high, I think. Following this, we focused with a total independent sample of more than 1,000 persons from the general population, this time representative of the population of Quebec, the province of Quebec. And we realized, based only on paraphilic interest and behaviors, that almost half of the sample had interest in any of paraphilic behaviors as described in the DSM, and 1/3 had actually at least experienced once such a behavior. So it's not that abnormal. We knew it, but we had to demonstrate it. Now, I don't know if you are aware of the last edition of the DSM-5 that came out this year, the text revised. And to my biggest surprise, I couldn't believe it. I was really happy to see that they are actually cited our study in a Quebec internet and phone survey samples like 3-4 times in the DSM, saying that, well, okay, it's not that simple. Maybe people, they do have sexual interest in illegal themes like voyeurism here. And I was quite happy with that, because it puts more nuance in the link between fantasy and behavior. And then the next thing that happened, I think is really interesting. It came from Ontario, actually, especially Michael Situ, but also John Bradford from McMaster University, and Samantha Dawson, and the spouse of Michael, Meredith. And they had the great idea of measuring what they called concordance of paraphilic interests and behaviors among the general population. Again, more than 1,000 participants, men and women. And what they found, first of all, is that the concordance, that means the relation or the similarities between having between a fantasy and the actual behavior in real life, this concordance is not that strong. It is present, it is significant, but it depends on several moderating factors, including the fact that, for instance, if you have, if the individual have fantasies about something that is consenting, something that is legal, like masochism, sadism, the link will be high. It will be strong. So if someone comes to you and says that he or she has BDSM, for instance, sexual fantasies, chances are great that he or she will do it. And it was the weakest for pedophilia, again, and fraternalisms. So they were the first, and this is what actually only last year, 2021, and they were the first to assess that concordance or non-concordance between paraphilic interests and behaviors. But again, they were talking about interest, not fantasies. It was more than fantasy. It was really, are you interested in this kind of behavior eventually? And decided us saying correctly that we didn't do that and we should. That's what we did. So that came out this year, and we went further to assess the concordance, but also discordance between paraphilic interests and behaviors based on the same data that I showed you previously. And what we saw is that, and I stressed that as expected, contrarily to most textbook, paraphilic interest predicted a corresponding behavior, but although it was only for approximately 50% of the cases. So one chance out of two. So if you are seeing someone, again, who has a given sexual fantasy, chances are like 1 out of 2 that he or she will not and never do it because they had no interest in doing this. In spite of the fact that we call it paraphilic interest, a lot of people, they are using sexual fantasies as a mean to enhance sexual arousal, but everything is kept in their mind. This is your secret garden. And a lot of people, especially among women, they specified to us that they would never do it in real life. So here what we see is that a sexual fantasy is not necessarily an interest. It could only be a fantasy. On the other hand, it could also be a very good predictor of acting out in the future or in the past. So we have to look at those moderators, those intermediate factors that will moderate the link or the non-link between a fantasy and a behavior. The first, before I switch to the next slide, I would it's really important for me to stress the fact that if you see, and you will see as a clinician, or even as a researcher among the community or a psychologist or whatever, there's a lot of people who have sexual fantasies, as I said, and as we demonstrated, they had sexual fantasies about illegal theme or themes that are related with BDSM and submission, domination, being spanked, or whipping someone. It doesn't mean that this is a wish, and especially for women, but for men too. You have to investigate further to go further than just focus on the simple content. What is known today is that the sole content per se of a sexual fantasy doesn't say much about risk of doing it. So this is what I will present you next, because this could be very dangerous actually, if a woman tells her boyfriend that she has fantasies about being forced to have sex or even raped. Of course, it doesn't mean that she has an interest to do it, but according to the DSM, it is an interest. So I think that we will see an evolution in the definition of sexual fantasies and their impact or non-impact in the future. But the fact is, even in sexology, sexual fantasies are understudied because it's still a taboo subject. And with the online surveys, there's a lot of problems with online surveys, but the main quality is the fact that we can not only have a lot of people, but it's more confidential and or relatively anonymous. So we can realize that a fantasy is not necessarily an interest, unless this you we will see moderators in the first part. It will be in forensic settings, and the second part will be among the general population. So I have like 45 minutes today to talk about a 3-hour class. So I cannot show you all the evidence. What I wanted I want you to know, and it's really important, and what I am about to present you, approximately half of those are hypotheses at this time. So I cannot present you with a kind of a checklist or a decision-making figure, because we are investigating those moderators. Some of them are demonstrated, some of them are not. So this is not for clinical purposes yet. The goal, of course, is to develop an instrument to go further than only look at the content of a sexual fantasy. But the first moderator is the type of sexual offenders. And again, I will refer to classic dichotomies or categorization between the so-called organized versus disorganized, or predatory, opportunist, or specialist versus generalist type of sexual offenders. I would say that the majority of sexual offenders, they are impulsive. They are the so-called opportunist, and they will act in a context with alcohol, drug abuse. It will be the result of an impulsivity. And again, I remind you, people without imagination tend to be impulsive. Having imagination helps us to not behave. It's like a buffer against behaving. So normally, to have a fantasy, a sexual fantasy, or any fantasy, like the fantasy to knock out a coworker, for instance, because you're mad against him or her, you will not do it. But you have it in your mind, in your fantasy, which is helping. It is, of course, it's the same for sexual fantasies, for sexual offenders. With the exception of the minority of sex offenders that we were talking about earlier, who are more specialized. What we call specialized, it means that they don't tend to have an antisocial kind of personality or history. They don't do a lot of non-sexual offenses. It could be there, but it's not the same as the antisocial type. And I saw at Pinel, sometimes it's not, of course, again, it's not the majority, far from there, but I saw some guys with binders and a lot of pages concerning one woman, in specifically one person, and they were predatory, of course. So these people are, by definition, they are not impulsive. It's the opposite. They could be very patient. Same thing for the exclusive pedophilia. A lot of men with exclusive pedophilia, they are grooming the kid. They take their time. They are buying gifts and stuff like that. They are not impulsive. So those guys normally, commonly, they have really, really elaborated, specific type of sexual fantasies, which could be a red flag, especially when you see that the person has one or two sexual fantasies, when now we know that among the community, the average is 6. So it's between 5 and 7 types of sexual fantasies. You have the primary sexual type and the secondary. The primary emerge usually during adolescence, young adult, and it's pretty stable throughout the life. But when you see that a person, whatever the content, that person has only one or two really fantasies and sexual fantasies, and they are exclusive, like they are necessary. They need that to obtain sexual arousal. If it's not that fantasy or that behavior, there will be no or lower sexual arousal. Now we are becoming to see something that could say something like, okay, this guy needs it, and he has no other fantasy. It's really detailed. And the next thing to look at is the richness or vividness and the IQ and other executive functions. So people could be the specialist type of a sexual offender could come up with very detailed, fixed, exclusive, specific behaviors. Will the behaviors will be more likely to be associated with the fantasy in this case. But these cases, again, are not the majority. On the contrary, what we mostly see in clinical settings is a porness, a few details, few fantasies, and they describe them with few words, and it's the type of behaviors is unspecific, impulsive, and unplanned. In these type, this is well known that the risk of reoffending sexually are lower than for the other type. Of course, the other type is the so-called specialist. So in this case, in the first case, sexual fantasy is really important. In the second type, it might not be that important. But you have to look at the type of appearance too, which means that, as we said earlier, we used to think that sexual fantasies are necessarily deliberate. You want to have them, and it's always occurring in the good context, never when you have a family dinner or you are at work. But if it does, you have the ability, again, it's an executive function. You have the ability to stop thinking about it and say to yourself, like, well, it's not a good time, or I don't want to talk, I don't want to think about it. But sometimes the emergence is automatic. It's against the will, and it could even goes to be compulsive. So we see that with people, especially in exhibitionism. The compulsion could be the sexual act associated with the obsession. So in this case, of course, the obsession is a very good predictive factor of the corresponding behavior, because it's almost by definition. But there's a condition called alexithymia, and there's a really well-known scale from Toronto, the Toronto alexithymic scale, where you can see that people who, by definition, these guys have a hard time to describe their own feeling, but also feelings and emotions of other people. And this is where it's getting interesting, because they lack the imagination or the introspective capacity to describe not only their emotion, but also that of other people, which is really closely associated with the theory of mind, with empathy, with imagination, with mentalization. For me, it's all the same construct. And you know what? They are impulsive, and they could present with a lot of outbursts. So this quality of a fantasy is pretty important, associated with the negative effect related. And following, for instance, a compulsion, you can have guilt and depression. So it's not positive at all. And you should also, make the difference between an impulse and an impulsive and compulsive. It's not the same thing at all. don't have the time to talk about that, but this is the kind of factors that you should look at beyond the simple content of a fantasy. Now, among the general population, which is, I think, really important, but especially in when we are thinking about prevention, primary prevention program aiming at the community, what we saw, this is proven, and it's pretty obvious, when the content of the fantasy is illegal, the vast majority of people in the general population they will refrain from doing it. There's a huge difference between I should have wrote sex, like between women and men, as I already said. And here is the important thing: among the general population, including like our psychology college students, the fact that there are personality traits. It's not necessarily disorders, but traits. And the famous dark triad, it doesn't work with Machiavellism, but it works a lot with antisocial, psychopathic, and narcissistic traits. So this is really well demonstrated, and it's again pretty obvious that someone who has traits of psychopathy or narcissism, they won't care about the other person. Sometimes they cannot even put themselves in the place of someone else. Really low empathy levels, and this sometimes and often it's paired with cognitive distortions, like the famous rape myth. So acceptance. So if you have rape myth associated with antisocial traits, now this is a red flag. And if you paired it with sex drives, sexual drive, when it's higher, it's always a good predictor of acting out. Now, what is less clear is the difference between typical and atypical content. It's not that simple. Someone with a really typical sexual fantasy, like making love on a beach, the chances are really good and elevated, of course, that person will do it in real life. But it's also true for really atypical sexual fantasies, like having fantasies with baby diapers, balloons, stuff like that. But we statistically, it's really rare, or under 2 standard deviations from the mean or the median. Those 2 types, when it's really typical and it's really atypical, are good predictor of acting out. The function of the sexual fantasy is important too. You can ask the person if it's only for the realm of sexual arousal, or if it's a genuine desire to realize it. Of course, this is really important to know, but we don't usually ask it to people. We are doing it more and more to realize that most of the time it's not a desire necessarily. And of course, if it's already done in the past, it is a risk factor, of course, because the future, the best way to predict future is the past, but this is not really surprising or useful. Now, the last slide. You will, by the way, receive a copy of the PowerPoint. So I should have said it before, but on the last slide, you can see that what we are considering separately in research, at least, like impulsivity and theory of mind, lack of perspective, low mentalization, low empathy, poor imagination. And in neuropsychology, we call it executive dysfunctions. In psychology, it's below or average intelligence. We have we think that this is all related. All these concepts are related, and they produce acting out. So it's not necessarily based on the imaginary world. On the contrary, actually, it's the opposite. So this is for most of sexual offenders. It goes against actual theories of sexual fantasies as a risk factor. So there's a lot of moderators, and as usual with human being and human behavior, it's not That simple, the link between fantasy and behaviors. 45 minutes. That's it for me. Thank you very much.
Thank you so much, Dr. Joel. That was a really fascinating talk, and I think really enlightening for lots of people who work in this area and who don't work in this area, both in terms of knowing more about just what things look like in the general population. Because I think sometimes we think, oh, all this sort of deviant and atypical stuff is the realm of people who engage in problematic sexual behavior. But in fact, that's not the case, right? And there's other factors that are really sort of distinguishing those who engage in problematic sexual behavior. It's not just the fantasy in and of itself. And that's really helpful to be able to think about that. But it sounds like there's a particular group for which that's.
But I'd like to add something like this on this, because it's really an important point. Since the first publication came out, we received a lot of email from people who were distressed by their own sexual fantasies from the general population. Like, it's written in the DSM, I have a mental disorder, I'm fantasizing about this and that. Mostly BDSM stuff, but
Yes.
so thank you very much for doing this. And I couldn't believe that there's a lot of distress. So as clinician, you should ask for more than that. So is it a wish? Is it an obsession? There are scales to measure that. Is it associated with positive or negative? If it's negative, it's like 20% of the male population has homosexual or same gender fantasies.
Yes.
And some of them are really distressed because of religious or attitudes, and they don't want to have them. And you can just tell them that doesn't makes you a homosexual. It's kind of, it's common.
Yes. Yes.
Yeah.
Well, we were talking about that actually during your talk, and just how important this work is, and that as clinicians we have lots of work to do to normalize diversity within sexuality, and recognizing that it can be healthy. It's not necessarily a problematic thing, and that there are these other factors that tell us more about what's going to be problematic. Yeah, thank you. So we have so many questions, so let me get to them for our audience members. So has there been research done with individuals who engage in sexual offenses pre and post offense, asking them about the strength, frequency, how long the fantasies were prior to the offense and then after?
Yes.
So yeah, exactly.
Yeah. There was a time, especially from Pinel, from Jean Proulx and André McKibben in the 90s. They were pioneers in this type of thing, because we had at that time we had units devoted to sexual offending, and nowadays it's not the case. But they asked all their clients to write down like several times a day their sexual fantasies and their impulses and stuff like that. But more, they also had to write down what they felt, how they felt, and they were among the first to demonstrate that prior to the offense, a lot of, especially among those who had sexually offended against the children, there were negative affect, and it was not positive, it was not appetitive. And I saw also in exhibitionists, when they at work, for instance, they were rejected, especially by a female co-worker. They felt bad, they felt rejected, and they have the impulse to, it was not predicted, but when they saw a woman across the street, now they flashed. And but before, they were like they felt really bad and rejected. So now I will do something to a woman, she's right there. So it's in response. It was not like I've been thinking about it for weeks and I will do it on Sunday. So no. So again, I think the major component is impulsivity. But does not happen just like that, coming from out of the blue. So yes, so again, to shortly answer the question, take a look at the work of Jean Proulx in the 90s in sexual abuse, and André McKibben, and you can take a look at people who are citing them. So you will see a lot of research that has been done. It's not longitudinal. It's, you have to ask about the past, but still, it's really interesting.
Absolutely. Thank you. I wonder about your thoughts around sort of the increased availability and accessibility of pornography, and what role that has had on people's fantasy world and imagination when it comes to sexual fantasy.
What a great question. I had the same for a few years now. And okay, I will, we have been trying for like 3 years to conduct the same kind of study with adolescents from the general population, just to be aware, like, again, as I said at the beginning of the talk, most of the studies, they don't have comparison group from the general population, which is the same for adolescents. So the stuff that I showed you, we don't know if it's only because these are, they lack imagination, and that's the reason why they act out, or is it not the case for almost all adolescents today, not only because of pornography, but because of the cell phone? In my time, when I waited for the bus, I was thinking, no cell phone, no internet. And when we were looking at a Playboy magazine, it was a really rare event, and there were no internet, no pornography, so we had a lot going on in our minds. Now the thing is that most head of schools, of elementary and especially secondary, like high schools, they don't want us to ask their students about their sexual fantasies. They are really afraid of their parents' reaction, so it's really, really difficult. But still, we will do it with a professional survey company, and we will aim at people aged between 14 and 18 about their imagination capacities, not only their sexual fantasies, to see if to have a comparison group. That being said, I truly believe that imagination is much less important than it was, and we can see it with the behaviors and sexual behaviors has changed a lot over the years, in parallel with pornography. There's a lot of things that I will not name now, but everybody can think of behaviors that we didn't see before, and now they are kind of mainstream. And this is really sad, because adolescents today, without sexual education at school, they think that this is like this is what sexuality between two person is supposed to be, because it's on the internet. But on the internet, it's really specific, it's men oriented, and this is sad, but good question. We are actually working on it.
Wonderful. Okay, so we'll watch for that research. What kind of related, just as you're talking about adolescence, there's a question about, are there any particular concerns if adolescents are it says, expressing or experiencing more deviant fantasies? Like, is there something about sort of a younger age? Is there any predictive around that? Yeah.
It's like cruelty against animals when you're 12 and you are cruel against a cat. You don't see that often. Normally you want the cat to be happy, and it's the same with deviancy. The thing is that for the vast majority of youngsters, it's the same as watching a violent movie or playing a violent video games. For the vast majority, there's no fundamentals for them to follow that path. But for a minority who had a predisposition, and if they see something deviant, they can go into it, and it's not only curiosity. And now I saw most of the time we had conducted a study about BDSM practitioners, for instance. It's still not published, with over almost 1,000 practitioners, and they almost all said the same thing, that they had the proclivity to play with bondage when they were young and when they were playing cowboy and Indians, and they liked a lot to be tied up, but it has nothing to do with sexuality before it was, of course, but it was still there. This is what I call the primary type of sexual fantasy. It will stay with you for the rest of your life. This is the primary with some variation. So when you have it comes up during adolescence normally,
Yeah.
commonly. So it's if you have something that is truly deviant, I mean, against the law, it's not only like a foot fetishism, like any fetishism is you can see it as soon as adolescence. And again, it's a 50, unfortunately, I have to say it, there's a lot of shades of gray. So it's a continuum like anything in life. So sometimes you have to demark and to put the point at deviancy. So yes, the younger you are, whatever the interest you have, but the higher chances that this interest will be fixed over the life.
Okay. Thank you. One of the questions as well, I know we've only got a couple of minutes, was, is there, does asking about sexual fantasies, does that increase risk? So as a clinician, if you're assessing for that and asking people to talk about it, and you're asking questions around some of these moderators and asking people about that, is there a risk of increasing the potential for them to act out on that?
Yes, of course. We cannot, and we don't do that. With every individuals. It's the same. What we do at Pinel mostly is group therapy, but it's not good for everybody. Sometimes you have to go one-on-one, and people are more distressed and they are more vulnerable. And when they talk about their crime, sometimes it could elevate your arousal. And if there are 8 of them talking about what they like, it could have the opposite effect. That's true. That's true. And on that point, I would refer to the clinicians working on the field, for instance, at Pinel, because I don't remember exactly what are their criteria to say, well, this guy, maybe we shouldn't talk about that too long. It happens when the scenario, the script is really detailed. For instance, as I said, but maybe I didn't say, but when we ask people from the general population to describe their own fantasies, they usually use between 100 and 150 words. But we also receive 3 pages, and it's really detailed. Now, this is a little bit like, you should be concerned about that. So I wouldn't go like to talk about that fantasy for 1 hour with that person. It could have the opposite effect. And also, I saw a lot of psychotic episode. Sometimes you can just provoke it, and the clinicians, they can feel it. Well, maybe not with this guy. It's the contact with reality is not that good. And yes, that's a case by case.
Okay. Well, thank you. We have so many more questions, and I apologize to everyone. We can't get to all of them, but we are at 11 o'clock. We've even gone a little bit over. Thank you so much for this talk, Dr. Joyal, and answering all of these questions. I think just all of the questions and all of the comments show you that there's a lot of interest in your work, and that this has been a really helpful lecture today. So thank you so much.
Okay.
And I'll just, oh, sorry, go ahead.
I just would like to say one last thing to everybody who's still here. If you have questions, again, do not hesitate to contact me, to email me, because what I like is having feedback from people on the field on a daily basis, because they had a lot of good insight that we can test as a researcher. And it's really, it goes hand in hands. What we are doing is really clinical stuff, but so do not hesitate to contact me with any questions or suggestions.
Thank you so much for that. I'm sure everybody is very appreciative of your willingness to be in touch and be contacted. And please join us next week for Dr. Ivan Zinger, who will be speaking on the mental health and human rights perspective of the Federal Prison Ombudsman of Canada.
Thank you. Thank you again for having me with you. It was really appreciated.
Thank you, Dr. Joyal. Have a great
Bye-bye.
week, everyone.